Hello, my name is Cassidy and I'm going to be your student nurse today. Today I'm going to be performing the neurological assessment on you. I'm going to perform hand hygiene and clean off my equipment. Okay. I'm going to start by assessing the 12 cranial nerves. First, cranial nerve 1. This is the olfactory nerve. So I'm going to ask her to close her eyes and cover one nostril. And I'm going to have her identify a familiar scent.
Peanut butter.
Okay, do the other side.
Peanut butter.
The patient was able to identify that this was peanut butter. Cranial nerve 1 is intact. Next, cranial nerves 2 and 3, optic and oculomotor. Sorry. I'm going to assess this by checking pupillary reaction. Pupils are pearl, equal, round, and reactive. 2 light. Cranial nerves 2 and 3 are intact. Moving on, cranial nerve 3, 4, and 6. This is the oculomotor, the trochlear, and the abducens nerve. These nerves are responsible for eye movement, so I'm going to test this by performing the 6 cardinal fields of gaze test. Go ahead and look at my pen light and follow my pen light with your eyes, not your head. Middle, down, across, middle, up, back to center. Good job. Patient was able to follow my pen light with her eyes. Normally, I didn't see any extra eye movements. So cranial nerves 3, 4, and 6 are intact. Next, going back to cranial nerve 5, this is the trigeminal nerve. This nerve has both motor and sensory functions. So I'm going to test motor functions by feeling right around her jaw, and go ahead and move your jaw back and forth and clench your jaw. Good. Patient was able to perform those movements and they were smooth. Next, I'm going to assess the sensory portion of this nerve. So I'm going to take an object. Here I have a Q-tip. It has a soft end and a sharp end. So I'm going to run this along the side of your cheek with your eyes closed, and I want you to tell me if you feel the sharp end or the soft end, okay?
Soft. Soft. Sharp.
Okay, my patient was able to correctly identify between the soft and the sharp end. So cranial nerve, what are we on? 6 is intact. Moving on to cranial nerve 7, this is the facial nerve. I'm going to test if this is intact by asking you to smile, frown, close your eyes, puff out your cheeks. Okay. Cranial nerve 7 is intact because she was able to perform those without difficulty. Now moving on to cranial nerve 8, this is the auditory nerve. I'm going to check this by performing the whisper test. So, cover one ear. I'm going to repeat a 2-word syllable, and I want you to repeat it back to me.
Baseball. Apple.
My patient was able to repeat back to me the 2-syllable word, and just by talking with her, she's been able to follow my directions, indicating no problems with hearing. So cranial nerve 8 is intact. Moving on to cranial nerve 9 and 10. This is the glossopharyngeal and the vagus nerve. I'm going to assess whether these are intact by asking you to swallow. Okay, I was able to see that she swallowed by the movement in her neck. And now I'm going to ask you to open your mouth. Say ah.
Ah.
Do it again.
Ah.
Uvula rose when she said ah. So cranial nerve 9 and 10 are intact. Now cranial nerve 11. This is the accessory nerve. I'm going to test this by asking you to shrug your shoulders up. Push your head against my hand on the other side. Okay, patient was able to do that without a problem and overcome my resistance. Cranial nerve 11 is intact. Lastly, cranial nerve 12, this is the hypoglossal nerve. This is tongue movement and just tongue abnormalities in general. Not in general, but you know what I mean. So go ahead and stick your tongue out. Okay, tongue is midline. There's no deviation in the tongue, indicating that cranial nerve 12 is intact. All right, all 12 cranial nerves were intact, and she passed that portion. Next, we're going to move on to motor. So I'm going to ask you to stand up. Go ahead and walk towards me like normal. And walk back. Alright, good job. You can sit down. As she was walking, I was observing her gait. Her gait was normal. She didn't have any hesitation or swaying. Her feet were shoulder width apart, and I didn't see any involuntary movements. So that is normal. Next, just looking at her, I'm looking for any noticeable muscle atrophy, which I don't see. Her muscles seem to be the normal size for her age and her gender. Next, I'm going to test motor strength, starting with the grip test. So don't let me pull my fingers out. Okay, hands are, her grip was strong and equal bilaterally. Now testing the fingers, go ahead and bring the fingers out against me. Fingers are strong and equal bilaterally. Next, testing the strength of the arms. Push down and push up. She was able to overcome my resistance, and it was strong and equal bilaterally. Next, checking the shoulders, go ahead and shrug up. Good job, strong, equal bilaterally. Again, now testing the legs, go ahead and push out against my hands and go in against my hands. Okay, her legs were strong and equal bilaterally. Lastly, testing her ankle strength, I'm going to put my hands on the top of her feet and ask her to extend them, and then again on the back side and ask her to go against them. Okay, she was able to perform that equally, and they were strong on both sides, so everything looks good. And that is the end of my motor portion. Everything was normal. Next, moving on to the coordination portion, I'm going to ask my patient to stand up and go ahead and walk towards me like normal. Walk back. Now this time, when you walk towards me, go heel to toe like you're taking a sobriety test. Good. Now walk with just your heels, the heels of your feet. Now walk just on your tiptoes. And lastly, walk, your heel running down your shin. Alright, good job. Patient was able to perform all those tests normally. She was coordinated with her movement. She wasn't losing her balance. Everything looked normal. Next, I'm going to do the Romberg test. So I'm going to ask you to stand up. And I'm going to ask her to close her eyes, face the camera with your feet together. And I'm just going to be here for support in case she falls. A normal finding is that she's able to stand here with her eyes closed with minimal swaying for 20 seconds, which she's doing. So that's normal. Next, go ahead and hold your hands out with your palms facing up. This is the pronator drift test. And what I should find is that neither of her hands are like dipping down or turning over, which she's able to do. Everything's normal. Good job. Alright, you can sit back down. Next, I'm going to check her rapid alternating movement. So what I want you to do is have your hands on your lap and go like this as fast as you can. Okay, patient was able to do that. The movements were smooth and quick, bilaterally. Good job. Lastly, for coordination, I'm going to do the point-to-point test. So I want you to touch your nose and then touch my finger wherever it goes. Okay, patient was able to perform that test with ease, and she was able to meet my finger, and everything was normal. Movements were coordinated in all aspects. That's the end of my coordination portion. Moving on to sensory. I'm going to do a test called the sterignosis. I'm not sure how to say it. But I'm going to take a familiar object and close your eyes. I'm going to place it in her hand, and I want her to be able to identify what that object is. So this is my object.
Cell phone.
Good job. Okay, She was able to identify the object. She passed that test. Next, I'm going to perform the graphesthesia test. So I'm going to write a number on her hand with her eyes closed, and she should be able to identify it. So this is the number I'm going to write.
3. 3.
Good. She was able to identify the correct number. Next, I'm going to do the point localization test. So I'm going to point to an area on your body, and you're going to have your eyes closed. And after I'm done, I want you to tell me where I was pointing. All right, good job. She was able to identify where I pointed on her body in all areas. Next, this is the 2-point discrimination test. So I'm going to take a paper clip. So it has 2 points on it. So I'm going to be touching her with either 1 point or both points. And I want you to tell me if I'm touching you with just one of the sides or with 2 of the sides. I'm going to start with her arm.
1.
And she does have her eyes closed.
2. 2. 1.
And then you can also, if the patient's having trouble identifying it on her arm, you can try her hand because her hand has more nerves in it, and she may be able to feel it more easily. I guess I'll just demonstrate how you would do that the same way.
1, 2, 1, 2.
Good. And then on her legs. Again, the patient might have a little trouble doing the legs and the arms, but that's not necessarily abnormal.
1. 1. I can't feel both.
It's 2.
2. 1.
Good job. So she had a little trouble on the left side, but nothing to be concerned about. That's pretty normal. She was able to identify all other points. Lastly, I'm going to do the extinction. So she should be able to identify whether I'm touching her on her left or right side and where, and then the other one, which I don't want to give away, so I'll show you. So I'm going to point to somewhere on you. I want you to point to where I'm touching you and tell me which side.
Right thigh.
Point where?
Left.
And then where am I touching you at?
Both.
She was able to identify where I was touching her on the left and the right, and she was also able to recognize that I was touching her on both legs simultaneously. Everything was normal in the coordination portion. No, the sensory portion. Lastly, this is the deep tendon reflex test. I'm going to check the reflexes in her knee and her Achilles. I'm going to move the camera down a little bit. So the thing about this is you want to make sure your patient is relaxed and that they're not nervous. And especially if they're younger, you want to make sure they know that this is not going to hurt them, because if they are tense, you may not get that reflex. So go ahead and just relax, and their legs should be, slightly flexed like that. You're hitting right below the patella. Her legs moved slightly. It may be because her feet are, can you scoot back to where your feet are dangling? Her feet were on the ground, so that's probably why. Okay. So that was the test.
But she failed.
But yeah, she wasn't really showing much reflex. It could be for many reasons. Maybe she's tense. And she has her feet on the ground, which they really should be dangling, but there's not enough room right here. But I'm assuming they're normal because everything else was normal and she's healthy. I'm going to now do the Achilles reflex. This is testing the reflex. You hit it like right here on the foot, and I should you should see the foot like go up a little bit. again, she has her feet on the ground, so this isn't the best way to do it. You can't scoot back anymore.
Back as far as I can.
All right. So her
I
feet.
mean, I'm holding my legs up if I do that.
Okay. All right. So that one moved slightly. Okay. Her feet did move slightly. She's holding her feet up, so she's tense, which is why reflexes aren't really strong. But everything was normal, and she was able to perform all of the things I asked her to. And that is the end of my neurological assessment.
Good job.